Chest X-ray reveals patchy infiltrates right lower lobe. What is the most appropriate initial antibiotic? 7-year-old man, COPD, ED, 4-day history, increasing productive cough, fever, shortness of breath. His vital signs are as follows: 38 degrees Celsius, pulse 105, respirations 22, blood pressure 130/85, O2 sat a little low, we're 90, but we're okay. Physical exam, crackles are heard over right lower lung fields, okay, and patchy infiltrates in the right lower lobe. So does he have pneumonia? That's my big thing. It seems like we give azithromycin to all of these pulm issues, especially just like an acute exacerbation. He already has COPD. The patchy infiltrates. We hear crackles.
So what do you want to go with?
Vanco might be a little too much. Amoxicillin is going to be like our gram-positive coverage. Azithromycin and ceftriaxone are going to be like both gram-positive and negative because we don't know what it is. And he already has COPD, shortness of breath, cough, fever. So he has all those things. So I think he is levo. I don't like. Otherwise, I don't like. Yes, I'm between like A and B here. It seems like for any 7-year-old man that you would give ceftriaxone and azithromycin and not amoxicillin. Even though I know like community acquired is going to be most likely like Staph aureus or something gram positive, but I'm trying to see if there's anything, if I know with COPD, if there's something that's more likely to exacerbate. We've had a 4-day history. The cough is productive. Yeah, I think I like that. I'm not the most confident about it.
Yeah, great answer. So
Okay.
let's talk about this. So, this is community-acquired pneumonia, right? And remember, what is
Okay.
the most common bug for community-acquired pneumonia?
I thought it was strep or Staph aureus, but it's not. I
No, no,
guess it's strep
it's strep
pneumonia.
pneumo.
Okay.
Yeah, strep pneumo
Okay.
is the number one. Okay, that's going to be the
Okay.
number one. You could have some atypical things like myco, right? Mycoplasma
hmm
pneumonia, right?
Like
And
the
things
what,
like
but I think like walking pneumonia with mycoplasma
yeah,
usually. Like,
yeah, exactly. Those are
okay.
more walking, right? And so in this
hmm
case, right, especially with someone with COPD, right, you definitely want to, give definitely ceftriaxone is always good, right? Always good for pneumonia for strep pneumo. Okay, that's always
hmm
great. And then a macrolide is going to help cover kind of, the walking pneumonia stuff. So you're double coveraging here, right? For
Okay.
atypical walking pneumonias and also on top of it, your regular like lobar pneumonia like strep pneumo. Okay.
Okay.
Um, Amoxicillin, right, can be right in previous healthy patients without comorbidities and or risk factors for drug-resistant pathogens. But COPD, you want a broader spectrum, right? Clindamycin, not
hmm
first line for community-acquired pneumonia, never is, never will be, right? Fluoroquinolones, right? So levo is actually pretty good, but it's not really first line. Usually they use it as an alternative. Okay,
hmm
Vanc, right, and Piptazo, this is really broad spectrum, right? And usually for hospital acquired pneumonias, right? So strong,
Yes.
right? So you're talking about, being on the ventilator for a long time, they get pneumonia, or they've been in the hospital for 3 weeks and they get pneumonia, right? Now you're like, oh crap, they probably got a super bug, right? Then you want to
Okay.
put them on like Vancomycin, right? Because
Okay.
Tazobactam is Zosyn, right? And so you want to put them on both these because they're just so strong. But definitely for sure, community acquired pneumonia, right? You don't see someone walking in the ER and you're like, oh, you know what? Let's just blast them with the highest line antibiotic, right? So
Okay.
definitely ceftriaxone and azithromycin is a good answer here.
Okay.
All right.